especially for underserved communities. And our vision is a world where all aspiring and current health professionals have a mentor. And the next slide. So who's my mentor? There's a large team that keeps mi mentor running. So our executive board here is groups of people like me and you. They're like pre-meds, mostly pre-meds, and they kind of help run mi mentor. And we're all supported by a group of physicians, mostly physicians that are part of the Alliance and Mentorship Board. So you can also see all of those physicians and other healthcare professionals that help support mi mentor and help support the executive board. And we have many sponsors as well that keep us providing, usually when it's not COVID, we're able to provide these types of presentations in person and it's a lot more interactive. So we have a lot of people that sponsor us and help with funding. And these are all the different organizations. You see Davis School of Medicine and other organizations that help keep mi mentor going.
Okay, so I briefly want to go ahead and go over some Zoom etiquette for our presentation this evening. So if you could please keep yourselves muted throughout the presentation, turn your cameras on if you can, and please submit your questions in the chat box. And Ayeli went ahead and posted in there whose last name to send which questions to, just so we can keep that clear for speakers and not distract them. And if you could please stay during the full duration of the event. And then, so this is our Together down the 15 experiences. So we have Vanessa Mora, who is a second-year medical student at UCSF. And then we have Jacqueline Leon, who is now an MS4 at UC Davis. And so I have put the post survey link below, and we will also put it in the chat box. And so for those who fill out the post event survey, you will have access to the speakers' emails, and it's being recorded. So for those who didn't get the chance to attend, if you know people, our social media team will go ahead and post it up on the YouTube. And with that, we will go ahead and pass it to our speakers for the evening. I'm going to go ahead and stop sharing my screen. Okay, and it's all for you guys.
Okay, awesome. Well, you can call me Jackie. We're really excited to have you here, and I'll also let Vanessa introduce herself as well. Really excited to talk about activities, because I think activities is kind of like, you kind of know you kind of know it, but then also too, as you go through it, it's kind of like a little bit tricky. So hopefully by the end of the session, we can provide some like pro tips, but then also to maybe share some stuff that we wish we would have done differently. And so, yeah, I'll go ahead and share my screen. Meanwhile, I'll let Vanessa just kind of quickly say hi while I do that.
Hey everyone, my name is Vanessa. I'm a second-year medical student at UCSF, just starting my clerkships. Like Jackie, I'm so happy to be here to go over the experiences section with you all. I'm an applicant who, took 3 tries to get into med school, so I've done the experiences section many times. So definitely did a lot of things wrong and learned a lot of lessons along the way. So excited to be here today.
Awesome. So I always got to do the sound check, visual check. Can everyone hear us and see the slide? Thumbs up or yes? Yeah. Someone tell me yes.
Yes.
Okay, awesome. So I'm a very interactive person. I can totally understand now when I'm on the other side. It's kind of intimidating to talk to like a room of nothing. So please, by all means, like feel free to unmute, say hi, like, question. Myself and Vanessa are very like want to make this very conversational. We definitely have like informative slides, but we want to make this as if like we were all together in person. With that being said, we both kind of want to get to know who exactly is in the room. So if you can just share with us, where are you in your pre-med journey? Are you like a third year in undergrad? Are you a post-bac student? Or like, just tell us like where you're at. And so that way we can get a good sense of like who we're talking with. Go ahead and put in the chat. You could also just like, you know, call it out as well. Okay, let's see. We got some undergrad 4th year. All right. We got, I'm in my gap year, undergrad, recent post-bac grad. Okay, undergrad, 2nd year gap. All right, they're coming. All right, gap year, non-traditional, growth years. I love that. Growth years, yes. Post-grad ×2, applying to medical school this cycle. That's right. Post-bac, I'm in my gap year. Okay, so it seems like it's a lot of gap year. Grad student applying. I was also grad student applying too. So what's up? Also did a lot of growth years as well, coming out of my gap years. Okay, all right. So so we have that. And then also too, if you can let us know if you are planning to apply within the next year or within the next year or two. Tell me how many years you're thinking about applying. Is this all people who are trying to apply this upcoming cycle? Okay, the cycle next year within the next year. Okay. This upcoming cycle. Okay. Anyone else wants to chime in, kind of where you guys are at next year, this cycle? Awesome. Okay. Great. So that kind of gives us a sense of, you know, who we're speaking with. And I think you're all like, you guys are all at the right place. And I think a lot of information, it will kind of seem like a little bit like early. I think this is good information to hear because as we talk about certain things, you'll kind of notice like, okay, these are some things I should start working on, or it's like, oh, you know, this is kind of like all a little over my head, but you can be like a couple months later. I remember Vanessa and Jackie talking about this. So, you know, with the email that they're going to share later, you guys can hit us up for more information. So with that, we'll go ahead and get started. How do I go to the next slide? Let's see. I'm telling you all, I struggle bus with this. So I'm just trying to figure out how do I go to the next slide.
Can you hit the arrow buttons on like your laptop, Jackie? Like where it has the up, down, left, right?
No, it just gives me a sound.
Oh.
I think maybe
Okay.
click the screen.
Oh, yes, you got to click the screen. All right, awesome. Thank you. All right.
All
So
right.
first of all, and kind of thinking about like the activity section. So a lot of us kind of know, you know, okay, personal statement, you got to talk about like why medicine, you know, and then with the activity section, the way that like we like to think about it, or the way that you should also kind of be thinking about it, it's another great like way to answer the questions to like medical school admissions. Tell me about yourself. Because when you're like sharing with them, tell me about yourself, you're basically telling them like all the different activities that you have done, kind of like leading up to like even when you maybe participated like since like high school to like undergrad to like even your like, I've heard of many of you are in your post-bac years, even grad school years, growth years. Like this is a way to kind of just answer this question like very beautifully. Also too, it's a great way to showcase your interest, your passion, your leadership, and also to your compassion given like the communities in which you hope to serve and advocate for. I think the biggest like, and I'm sure you guys have heard this a lot from like your advisors and your mentors, the biggest thing that you want to showcase through your activities, as well as it threading through your personal statements and your letters of recommendation, is you want to show this like unifying theme of the activities that you participate with. So for example, let's say you have this theme of like, you know what, I'm just so passionate about like giving like being able to provide like healthcare services, or even try to advocate for access to like, you know, people who traditionally don't have like healthcare access, let's say our immigrant populations, or even like, you know, I'm so passionate about like taking care of like little like kiddos, like being in pediatrician, this is where you get to showcase like that theme. Primary care, again, you know, like all the spaces, you try to like get that all together. And then also too, you want to talk about like your brand. This is kind of like what people talk about, like, oh, what does it mean, like your brand? So like, for example, if someone wants to be known for like, you know, I'm all passionate about like women's health, then you want to kind of have that unifying theme throughout all your activities. Also too, the other reason why you, and this is something that we kind of talk about a little bit, and I think you guys have it this in intuition as well. Like your activities is also a great way to evaluate the fit that you have between yourself and the medical school. So what do I mean? So let's say, for example, you're somebody who like loves research, you know, like you love, like you breathe it, and you're just like, I just want to learn how to like make the next breakthrough, or like in this particular type of disease or in this type of like medication. Then you're going to probably have a lot more research activities to, you know, have on your 15 activities. But then you also want to go to a school that also values like research. So that's something that you're going to also see as kind of like, okay, based on my activities that I have, what type of medical school will kind of like also honor that value. Same thing with like community service. I'm all about community service. These are all the activities that I've done. And this is another medical school that like values that as well. So I think the activity section is such a great way to evaluate the fit between you and a particular medical school. Any questions so far based on what we discussed? Again, a lot of this may be review, which I anticipate it probably is for a lot of you. If not, we'll just kind of go into the next section. I think for me, I just wanted to share with you all this information can be found through the MCAS application guide. So if you just Google it, you'll see this. And if you refer to page 46, it'll have some great information. And then also too, there's a workbook as well that is also information that we're getting this from as well. With that, we'll go to our next slide.
Perfect. Thank you so much, Jackie, for opening with that. So we'll just go into a bit of the format, just logistics on how to format your experiences section and what to look forward to. So first and foremost, when you go into writing an experience that you've had, you're going to have to choose from the categories that are listed here. You can see that they are very broad. They range from like artistic endeavors to different types of employments to even conferences. And so a lot of the time when you're trying to think of experiences, it can kind of not cross your mind that some of them might qualify. And so make sure you pay close attention to these different categories. Some of them are even hobbies. You know, you don't want to get out of hand with that, but it's a possibility. If it's important to you, you might want to consider including it. They allow a maximum of 15 entries. With that in mind, you don't have to have 15. Jackie and I will go into that later. I had 12. I didn't, have all 15. So don't worry if you can't have 15 and you're not really reaching that number. It's totally fine. Again, pay special attention to the category that you're choosing. As Jackie kind of alluded, it's really going to come into play when you're thinking about the types of schools that you want to apply to. So if you're applying to schools that, you're going there because they're known for research and that's what they do and that's what you want to do, then that should be reflected in your experiences. They're going to use this as a comparison to everything you're saying in your personal statement and everything that comes up in interviews. So if you're a person who's saying, I'm gung-ho about research and you don't have a lot of that experience that's shown here in this section, it can raise a red flag. And so making sure that it all aligns well with the school and your passions for applying to medical school. Next slide, please. Oh, I think we went a couple. Perfect. So other logistical things, you'll have to write the experience name. So whatever volunteer opportunity, if it was, write the name of the hospital, what it was called. And you'll have to write down who you were reporting to. So your coordinator, your boss, your director, whoever that was. You'll have to include some contact information for that person. I don't know if they actually call or if they use this information, but you will have to include it. It'll be either an email or a phone number. And make sure to follow up with all of these people. Make sure that that contact info is correct, just in case medical schools do find that they want to contact these people. For each experience description, you'll be limited to 700 characters. This includes spaces. This is not very many characters at all. This is like only a few sentences, maybe 4 sentences. And so what that means is that you're not going to have a lot of space for fluff. Like this area should be just directly describing like what you did. No, so you know, the experience is important, but like what you did specifically in that experience is the most important part. In 4 sentences, you should be able to describe your role, what you learned, and relate it to your why medicine. So like each of those sentences should hit on each of those questions. Make it very concise, straight to the point, so that you're not taking up a lot of characters with fluff. Anything you want to comment on this, Jackie?
Yeah, I think one of the advice that I was given was for contact information, try to list an MD or like a PhD. So like, for example, if you're doing research with somebody, you want to put the PI. Typically, they usually have a PhD, so you want to put the PI's name down. Also, too, when I was in the post-bac program, we put down the PI's name down. So even though I worked a lot with the coordinator, they didn't have a MD, but like the contact person that does a lot of the work for us or advocates for us as an MD. So that was what I was told. And I think that's pretty much it from that.
Yeah, I'll just say that for my post-bac program, we did the same thing. So we had like a director who was an MD, and she signed off on everything. She was the contact person, even though we didn't really have a whole lot of interaction with her. So just keep that in mind as well. Next slide, please. Okay, and then you'll have to choose 3 most meaningful experiences. And on top of the 700 characters, which you'll have to write for every experience description, the 3 that you deem the most meaningful, you'll have an additional 1325 characters, which brings you to a total of about 2,000 characters for that experience. Keep the kind of structure of what you're writing in each of those the same, meaning that for the first 700 characters where you're describing the experience, keep it to just that, right? So describing your role, what did you do? What did you learn from it? In the rest of it, so the 1325, where you describe why it's the most meaningful, make sure to describe kind of on a deeper level why that contributed to your why medicine. And so Jackie and I will share some experiences of how we did this in our experiences section, because it is easier, I think, to see rather than to just state how it's done. But this is really your opportunity to go into more detail on how this changed your perspective on medicine, how it contributed to you wanting to be a doctor, and being able to write a little bit more about that. A couple of things to consider is that, you know, you go through all of this time to write a great application to medical school, but admissions committee members don't always read the whole thing, unfortunately. And so this may be the chance for you to really highlight the 3 most meaningful ones, where if they don't have time to read all of them, they're going to read those 3. I've been in an interview where the person interviewing me was like, hey, full disclosure, I didn't get to read your application. Like, they didn't know much about me. They were supposed to, but they didn't. And so in instances like this, they may jump to things like your most meaningful experiences. And so make sure you kind of spend the time to really highlight those. Major themes to consider are clinical experiences. You really want to highlight those because obviously you're applying to medical school. And so any experience that you have in the medical field will be important to highlight. Leadership experiences and research experiences. Obviously, if you don't have one of these, it's not the end of the world, but if you do have them, it is a really good idea to highlight those as most meaningful or most important. If you're a non-traditional applicant, being in a post-bac program can definitely be substituted as a most meaningful experience. I know that was one of mine, and it definitely can be one of your most meaningful. And one thing that should be considered is that you should have letters of recommendation from the people that are listed under your most meaningful experiences. So again, we'll go more into detail on this, but definitely something important to consider.
Next slide. Okay, so this is some advice that and strategies of kind of like how to go about activities. So the biggest thing that you want to think about is what kind of medical school applicant do you want to be known for? So we talked about this a little bit in terms of like a unifying theme, right? Or these like core themes that are conveyed through your application, not just in your activities, but also that are streamed with your personal statement and your letters of recommendation. But I do have quite a bit of times where students will kind of come like ask me, they'll be like, Jackie, you know, like, I don't really know kind of like how to best like utilize my time, or like, what are the like core, like meaningful activities I should be participating in. And so one of the things that I always have my mentees or students who ask me this question do is I always have reflection questions for them to consider. So one of the things that you guys should be thinking about is kind of like, what kind of medicine do you see yourself doing? So like, for example, if you see yourself doing, you know, like you want to take care of like people's hearts, you want to do like cardiology, then you probably want to think about maybe doing an activity that has to do something with like heart health. It doesn't necessarily have to be like working with a cardiologist, but it could be like diet and exercise because it relates to heart health. You know, so you want to think about like, what kind of medicine do you see yourself doing is like one good reflection question. Another important reflection question to think about is, what is your favorite medical or public health issue to treat or advocate for? So for example, I know like a lot of people always like to advocate for, let's say, diabetes prevention. You know, a lot of people like to advocate for like women's health, or people like to advocate for like LGBTQIA health, you know. So if there's anything that just really kind of resonates with you, we're just like, you know what, I feel like this group is not taken care of like justfully, or like there are more like resources that we can do, or it could even be like a region. Like for example, for myself and even for Vanessa, we're part of SJV. And so we're very passionate about being able to provide resources and be able to treat, you know, the Central Valley region. And so, you know, we can participate in advocacy efforts, or even like other activities that support the health that predominantly like affects the folks here in the Central Valley. So that's something you want to think about as well, is like, what do you see yourself treating, what do you see yourself advocating for, which kind of leads to my next reflection question is like, what kind of communities and patient population do you see yourself serving? You know, are you seeing yourself like working with little kids? You know, do you see yourself working primarily with like Spanish speaking Latinx immigrant populations? Do you see yourself working with like trans people? Do you see yourself working with the elderly? So when you go through these reflection questions, then you start thinking about, okay, what are the activities that I should get myself involved in? Because that's where you're going to be able to create this theme that is coming across throughout multiple activities. So for example, I put one here, like, let's say somebody, and this is actually a true example. I had someone come up to me and said, hey, Jackie, like, I want to be an OBGYN. I'm like, great. You know, we need more OBGYNs, you know, in this world. And so one of the things that we brainstormed on was like having them volunteer at like a women's, you know, health clinic, you know. You could also become like a health educator at a school organization. You know, I know there's multiple like school organizations where like they're trying to advocate for like universal health care, or even like, you know, sex ed, like comprehensive sex ed, like throughout the school districts. Also like having access to like lactation rooms, like, you know, at the schools from like middle school, high school levels, even workspaces. Doing research, like you could do research on like any medical condition, you know, polycystic ovarian syndrome. You know, you could also do like research. We did this in grad school. I remember there was this activity where like we called all the local pharmacies, and we were calling each like Rite Aid, Walgreens, like did they have access to like women condoms, you know. And that's like a form of like birth control method that we typically don't think about, you know. So it could be advocacy even like on the ground. and also local, state, regional level. And so that's like different ways in which you can kind of think about getting yourself, involved in this space. Another thing that I want to talk about in terms of strategies is utilizing AMSAR, because it's actually, there's information there, and it's like such a great resource where it gives you like a breakdown of essentially kind of like what was the statistics and the demographics of like all of the matriculating students. And you can kind of see that there's a section which I will have some like pictures of like different schools, and like just kind of like what were the top activities that each of these schools value. And so we'll go do that now. But Vanessa, any comments do you want to add here?
Yeah. Thank you for this, Jackie. I just wanted to highlight that. So when I was applying to med school, I think this is something I struggled with, because I knew I wanted to go into medicine, and I knew that I was devoted to working with underserved communities, but I didn't know in what capacity that would look like, or, what exactly I wanted to do, like what specialty I wanted to do, or any of that. So I will say that for me, my experiences didn't have a like specialty theme. But what I did show was that I stayed pretty consistent in my value of working with underserved communities. So even if the opportunities didn't always present themselves as I wanted them to, for example, I got jobs as a medical assistant in dermatology. Like, they don't serve the underserved in any way, at least not the clinics I worked at. So I didn't really get that experience, but I was very true to what I wanted. And so after work, I would volunteer at other clinics that did serve underserved communities. And so not all of your experiences have to be embedded in that value, but as long as you are taking something away from them and you are still seeking out additional opportunities to fulfill that value that you are claiming, then that's still going to speak just as strongly. So I just wanted to add that, to highlight that point.
Yeah, thank you, Vanessa. So we'll go ahead and go to the next slide. So this is AMSAR. For those of you who don't already know, this is how you access it, and you want to go here to where the arrow is in terms of like the signing in. And basically, if you get the FAB, which is a fee assistance program, it gives you like a bunch of different resources in terms of like, I don't know if you get the MCAT. I think the MCAT is at a reduced fee. You also get like access to this. And if you're not able to qualify for it because it's based on income, I think it's definitely worth paying the 1 year or 2 year subscription fee. And that's the dates as of yesterday when we checked. But basically what you'll see is that, so this is basically, you'll scroll down, and this is for UC Davis. And this is all the like experiences that the matriculated class had. So if we just start from the top, like they have, shadowing. Is it required? No, but it's recommended. And then you'll also see like pre-medical shadowing requirements. Clinical experience is highly recommended. So already you can already kind of see like, okay, my game plan in terms of like this school, right? It's Davis. It's like one of my schools I want to go for. You probably, want to think about maybe having some clinical experience. Now, as you go down on the chart, you'll see kind of like where a lot of the students, like what type of experiences they have. So you'll already kind of see like a bulk of the experience here is, and for some reason I can't read it, but oh, okay, sorry, I had to move you guys. But over 90% of the students like had some type of medical or clinical community service / volunteer. So remember how we're talking about the different categories and like the different types. So this is kind of like the category. You guys get to choose like how you want to like classify that activity. So this is something you want to pay attention to. Also too, research seems to be very important as well for UC Davis. And then I would say the third highest is like community service volunteer. Now, if we look at like school, which is UCSF, you'll also see, like shadowing, recommended, pre-medical shadowing, not available, but, probably something that they would like to see. And then you'll also see here a breakdown of the type of activities that like the matriculant students participated in. So very similar to like UC Davis, they really highly regard medical, clinical, community service, volunteer, and they also highly regard research. And just like similar to Davis, they also like to see community service / volunteer. So this is something that you can look at for every school. We just showed these two because that's the schools that we're representing tonight, but you can look at like every California school, every medical school across the whole nation, and you can kind of see, okay, it looks like this school values these type of like activities. Maybe this is kind of like the activities that I can see myself wanting to kind of highlight. But then also too, on the flip side, you also want to think about best fit. So as you experiment with these activities, if it's something that you don't enjoy, then you don't want to go to a school that like really values that, and that's okay, so that's part of the process in terms of finding, what's a good fit school versus another school that maybe is not a good fit for you, but maybe a good fit for somebody else. And that's why there's like so many schools, because they're good fit for different people.
I just want to add one thing, Jackie. I've actually never seen this chart for UCSF, so this is like really cool to see. And I had no idea that the numbers were so high for like research. But so going into my application, I was really nervous about this because I actually applied with no research experience whatsoever. And I think that the main thing I want to point out is that if you are lacking in one of these areas, like don't take it as a complete discouragement to apply. Like I think if you have strength in other areas, like if you have a lot of clinical experience or you have a lot of volunteer work, so you didn't get to the research part, that's okay. Like apply, because that might be a strength that you're bringing that other people aren't bringing. And so kind of think about that as well. Another thing that I'll say is that I think going into med school, I always thought of research as like a really daunting thing. And I always thought of it having to be like basic science research, but there are so many ways to get involved in research after you start med school. So even if you haven't gotten a chance to do it yet, you can go in with the intention, if it's truly something you're interested in, saying that in your interviews and saying like, look, I didn't get to do it, but it's something that I'd love to try, if that's true to you. So it's not like an end all if you haven't done it yet.
Thank you for that point. I think it's, I felt the exact same way as well. I kind of was daunted by that. And I don't have a lot of research. I don't have any publications. So, even if you did a summer program, like that's fine. Don't rob yourself of that opportunity if that's somewhere where you want to go.
Okay, so Jackie and I will go into a little bit of our personal experiences and we'll share some examples that we wrote. And again, if at any point anybody has questions, like please feel free to unmute and let us know. So for me, as I mentioned before, I am a 3-time medical school applicant. So I'll only really be sharing experiences from my successful cycle because you all don't want to know about the unsuccessful ones. So for my successful cycle, I added a total of 12 experiences and I listed them below. I was pretty strong in terms of clinical work. So I worked as a medical assistant in 4 different positions through college and during my gap years. So kind of to the point that I like didn't apply with research. It says here that I have research, but I didn't include that in my application because I was doing that while I was applying. So in my application, I had a lot of medical assistant experience. I had my UCSF post-baccalaureate program, which was one of my most meaningful, and one of my letter writers was from the program. I also had a lot of volunteer experiences, so various health fairs. I did like an anatomy teaching event, and I volunteered at a hospital for several months. So non-medical things were also included in my application. I did a marketing job for about 3 years. So I did that for a really long time, and I thought it was still important to include. And a quality improvement project. So kind of research, but no publication came of it during my post-bac. For my most meaningful experiences, I included the 3 that are listed here. So one of my dermatology medical assistant positions, a hospital volunteer position that I had, and my post-bac program. And of those 3 most meaningful, 2 of those had letters. So the hospital volunteer didn't, because it had been like 6-7 years since I had worked there. So I didn't get one, but kind of to the point that we made earlier is that it is really important to at least get the majority of your most meaningful experiences to have letters of recommendations attached to them as well. I know a couple of the questions that we got in the survey were sent to us, and so we'll try to address those as we kind of talk about some of the experiences that Jackie and I will be sharing. So I think one of them was, how to really differentiate between the experiences description and the most meaningful section, which we talked about a little bit in the beginning, but another is how to write it, I guess, eloquently. I don't know if mine is eloquent, but I'll share mine. So this example here is my dermatology medical assistant experience. And I'll just read like 1 or 2 sentences of the description. So I assisted Dr. Llewellyn with skin exams, excisions, biopsies, and Mohs surgery for the removal of skin cancers. During exams, I interviewed patients about their chief complaints and annotated information into the EMR. So kind of going into this description, I'm purely stating what I did in that job. So I could, this could go many ways, and you can see I don't have a lot of space to write, but I'm really focusing on like I statements, like what did I do? What was my role in this position? Because ultimately you are the one applying to medical school, right? Not this doctor, not this clinical office. And so you want to highlight that because it can be very easy to sway from that description. In the most meaningful experiences remarks, I kind of go more into the lessons that I learned and what it meant to me to be in this position. And so I alluded to this earlier that even though I was in dermatology, this isn't a field that I want to go into necessarily, but it was meaningful to me because it was one of the first experiences where I was really allowed to have some autonomy as a medical professional. Like the doctor allowed me to help out in so many ways that it really opened my eyes to medicine. And I mentioned that in my most meaningful. And so I talk about how important autonomy was for me. I learned about how much I appreciated to have responsibility and professional growth. So I go into all of that in my most meaningful. And at the end, I close it off by saying, thanks to Dr. Llewellyn's guidance, I learned technical skills and matured as a competent and committed future healthcare provider. And so again, always wanting to highlight lessons that you learned, what you took away, and how you're going to apply it to your future as a physician are really important things to mention in your most meaningful experience section. Next slide, please. Another thing that we wanted to highlight is that if you do find yourself in a position where you have more than 15 experiences or you're trying to consolidate to include others, one possibility is that you can actually combine experiences into one. Jackie and I will both share examples of how we did that. But one way that I did that was I participated in a few like health fairs, and they were all just 1-day events where I maybe volunteered for about 8 hours a day. So, if you do a 1-day event, it's not super crucial to include it as its own thing. You really want to reserve those spaces for experiences where you have a significant amount of hours. The more, the better, obviously. And so for this experience, I included them all in the same one. So I just kind of talk about my role in different health fairs. I think I did like 3 different health fairs. And so I just talk about what I did for each of those. Again, no fluff, no like deep, profound meaning to them. There's just no space for it. It's just describing what I did in these. But again, these aren't some of the ones that I included as my most meaningful. So I purely just described what I did in those positions. For the last one, I included another example of one of my most meaningful. So this is my volunteer experience at the hospital that I volunteered at when I was an undergrad. So again, the top is the description of the experience. So just mentioning that I rotated through various departments, what my role was, providing patients with food, meals, taking them on walks, helping staff. So very descriptive in that way. And then the second part is going more into the kind of emotional, compassionate part of what I learned from that experience. So I go on to tell a story about a patient that I had when I was volunteering, a patient that taught me kind of the importance of just taking the time to have a conversation and just the humanity of medicine and how that kind of brought that back to me. And this is, again, something that I wouldn't really be able to describe if I was just left with 700 characters. So most meaningful experiences are that opportunity to expand on what they taught you and how that's going to pertain to your future as a doctor.
Oh, I think it automatically went. Yeah, there we go. So next I'll go ahead and speak about my experiences. So I was somebody who took close to about 10 years of gap years, and I also kind of danced around with medicine quite a few times. And so I had like moments of my journey where I was kind of like preparing for medical school, but then I kind of did something else. That something else was public health. I'm very passionate about public health. I was doing quite a bit of work experience as well as like volunteer experience in this field. I ended up doing a post-bac, and typically after the post-bac, you go to medical school. I wasn't ready to do medical school, so I did the MPH instead. And so, yeah, my experience that you'll see is very kind of like health leadership oriented. And I kind of broke it down here, kind of like what type of experiences I listed, and also to how many. So for example, the community service, I only listed the undergrad Latinx group that I was part of, which is called CHE. And then also for physician shadowing, I never shadowed a patient-doctor interaction before applying to medical school. So that's something that I also want to share with everybody. Like all my medical experience was like community health, at the health fairs, I never saw a patient-doctor interaction before. And so you can classify health education as like shadowing experience. That's how I classified it. Because that's the type of medicine I see myself doing. But when it came to leadership, I pretty much wrote about the enrichment program that I was part of in undergrad. Some of you may recognize it, Biology Scholars Program at UC Berkeley. That's where I listed as. Some people listed it, I heard from my friends, as like an honors awards program. I felt like for me, because I did a lot of leadership opportunities through BSP, that's why I classified it as such. I also did an MPH. I was also pretty involved in the student group there as well. I classified my post-bac program as a leadership experience as well. Some people, again, classified it as award. So that's what I mean, where it's pretty subjective how you want to classify it, and there's no right or wrong. And then I had 4 paid employments, which they're all listed there. And then for research, I counted even though I had like 10 gap years, I counted the experiences that I had in undergrad as part of research. Like I said, I didn't have any publications. I think the only thing I had to show for it was maybe like a poster, and that's totally fine, And so those were the 2 summer programs that I did there. And because I had so many different experiences, I also combined multiple within one entry. So kind of like how I listed there. I also did like public health department research, and I also did some undergrad research as well. I had a lot of years of experience teaching and mentoring. And so I combined I think 4 tutoring experiences into one. And then I also was a TA when I was in grad school. So overall in total, I had 15 experiences, and the ones that you see there in bold are my most meaningful ones. And there was a letter from each of my different meaningful ones. I was advised when I was a post-bac student to put the post-bac as a meaningful. So you'll see that I didn't have research. So that's where, subbing for one, it can be okay, especially if you're a non-traditional applicant. Next, I'll go into my examples. So some of you might come across a similar experience in terms of, using the post-bac program or some academic courses as part of your meaningful experience. So I'll kind of do similarly. I'll read kind of like a couple of sentences there, and then the last one. So in the beginning, you just kind of talk about exactly what it is. So the UC Post-Bac Consortium is a competitive academic program that focuses on increasing the number of physicians from disadvantaged backgrounds committed to working in underserved communities. So already you already know what the intent of this program is. This curriculum allowed me to further develop as an independent learner, carry on a full time of upper division science coursework while actively utilizing resources in a cohesive learning community. So it was really important to me to highlight what are the exact skill sets that would make me successful for medical school, in terms of being an independent learner, in terms of carrying a full load of upper division science classes, and also being in a cohesive learning community. And so the schools that I was really looking at were spaces that also kind of emulated that same type of family. When I go back, or when I go into the most meaningful part, this is kind of I don't know if most of you have experience kind of writing resume. This is very resume oriented in terms of achievements, numbers. You want to really highlight that here. So for the postbac program, I pretty much said, through my participation in the program, I was placed on Dean's List twice, performing in the top 4% of the students. My study habits and skills grew exponentially, different learning skills. Again, I was just really trying to highlight to medical schools that even though I had to do this postbac program, look at my achievement and look at these different reflection question or learnings that I made of myself. And you always kind of want to end that at the end of every description. So for example, here by the end of the program, I had grown significantly, became more self-aware, with renewed perseverance, vision, and hard work and balance, qualities that will serve me well in my journey to medical school. So you always want to rest assured, the medical school admissions committee, this is what's going to help you be successful. This is an example of one where because I had quite a bit of experience tutoring and mentoring students, I combined them all into one. And so for this one, I just kind of, I just put very vaguely, each organization provides academic advising and mentorship to underrepresented students, support academic excellence in the sciences, to facilitate transfer to college or professional school. So again, just with that one line, you can kind of already know, exactly what I was doing, and also to what type of students I was working with and how I was supporting them. And then here again, it's very resume oriented, how many students did you serve, and what exactly did you help them with? And then last line, I will serve as a physician champion to support students to pursue a higher education and health career. And this is very along the line of my theme of I'm very passionate about and will always continue to do mentorship, example, talks like this, I want to ensure that all of us together can, help change, the field of healthcare and have more of us, represent the patients that we hope to serve. And so that's kind of what you want to be able to convey in your activities. So we're pretty much wrapping it up, and I know myself and Vanessa, we can stay a little bit later. Is that still okay, Vanessa?
Yeah, I could probably stay for 10 more minutes.
Okay. And so we just want to leave you with just a couple of next steps. So again, go back to that workbook. Those screenshots that we provided was pretty much from the workbook. If you also Google AMCAS pre-med worksheets, they also have some worksheets that are pretty helpful in terms of those reflection questions, in terms of helping you think about what activities to go after. Also too, something that's extremely helpful is something that you could do right now, even though the application is not, going to be ready for submission until I think May or June. I think it opens in May, you can submit in June. I think that's how it works. You can start a Word document where you essentially have those templates, the experience type, the contact information, the name, and you can start already working on the description. It's basically the description part that's going to take a lot of drafts. So you can, what I would recommend is that you draft your experience descriptions with not too much detail or attention to the character limit, just free flow write it. And then from there, start working with your advisors and your mentors. And you also probably have seen that LMSA SNMA advising appointment. where you can basically work with various folks to help them finalize it. And as I was going back to my folders in preparation for this presentation, I saw that I had like 7 or 8 drafts. And so that's what I mean, that like, I didn't even think that this section was gonna need so much like drafting back and forth, like the diversity or personal statement. But like, that's something that you guys can do, especially if you have like a resume or a CV. Go ahead and start putting that in there, and then you can start like sending it off to people. And so you can start working on this as you get closer to submission date. Some pro tips here. Again, you know, the back and forth, anticipate that it's going to take weeks to months. Especially if you're trying to find, you know, the one word that's going to encapsulate, you know, multiple words because of that character limit. And then also too, before you upload it to the MCAS, you want to take that Word document into a text edit document, because for some reason the characters or the spaces, it's like kind of wonky if it's coming from Word into the MCAS. But if you put it from Word to text edit, then it's a little bit not so wonky. That's what I did, and it seemed okay for me. Any other pro tips or next steps you want to offer, Vanessa?
No, I think you covered them. Thank you, Jackie.
Okay. And so I know that we finished right at 8 o'clock. So again, we'll stick around for questions. I know that Vanessa and Anayeli have been busy collecting questions too along the way.
I think
Yeah,
we
so-
have a question. Someone's hand was raised. Let me see. I think it came off my screen. It was that Margarita.
Wait, hold on. Can we pause for a second?
Oh, yes.
I just wanted to let everyone know, thank you so much. I know we're right at 8 o'clock, and it looks like we'll stay for about another 10 minutes based on questions. If you guys could please fill out that post-event survey. Once again, for those who fill it out, you will receive the email for both our speakers. So now we're gonna roll into questions.
Sorry, Jackie, can we stop sharing screen so we can see the participants? Thanks. And I think Margarita, you had a question?
Hi, yes, thank you so much for sharing all these useful tips. I have never heard of like compiling multiple experiences that are similar into one category. And I was just wondering, how did you go about that? I know they have to have something in common, like for example, you mentioned the conferences or the tutoring. And then also when you do that, who do you list as your contact?
Yeah, I can answer that. So for example, when it came to like the tutoring, so first off, I will say that this is definitely a common concern, especially if you're somebody who kind of was trying to go into medical school after so many years and you have so many like experiences that kind of like show up for that. So for me, my issue was I had too many. And so I wanted to showcase kind of like, okay, I didn't want to put like a teaching experience as like unique ones because I felt like it didn't give a comprehensive sense of like who I was. So what I did is that I put in, I think it's one of the line items. I think it was like event name. I put the companies that I worked for there, but then I had one mentor who was she worked at one of the companies that I was tutoring for, but then because she knew that I was working at the other company, she can speak on behalf of like all my prior experiences. So she was basically a boss for one, but because she knew that like I had all these other ones, she could speak to it as like a mentor and an advisor, if that makes sense. So I didn't have to put like 4 like different bosses. It was kind of like, okay, it worked out that she was like my boss, but then also too was able to speak on behalf of my other experiences.
Got it. Thank you.
Okay, so it looks like in our questions that was asked in the chat says, Should we include our postbac as most meaningful, even if we did our postbac at UCLA Extension? For context, UCLA Extension has open enrollment.
I guess a question I would have is, I don't know how it would work in terms of letters of recommendation. I think for Jackie and I, we did a formal postbac. So we had a director who was an MD at those programs. And so I think that added some like strength to that experience. And so I think if you have a strong letter attached to it, then absolutely. Otherwise, I'm not too sure. I would say it could go either way.
Yeah, I agree. I think if you're a student who, if you needed to take academic classes because, you know, you're trying to show like, okay, this is my true academic performance, you know, undergrad, again, like for me, I was like working and I was like too involved in like extracurricular activities. So I felt like looking at my undergrad GPA wasn't like the most like representative. And so I needed to do a post-bac program. And so when I did the post-bac program, like this was like what I wanted medical schools to see, like I can handle the rigor, I can do the work. And so for me, and I think that's why like the post-bac program like recommended for us to do that. And I would say if you're coming at it with the same approach in terms of like, hey, medical schools, like I want to utilize the extension classes as kind of like, you know, this is what I can bring to medical school in terms of like, I can handle the academic rigor. I think you should. The only thing is that, again, was there an advisor that you spoke to that like helps some advising there? Or like, I'm sure there's probably like a mentor who could speak on behalf of your academic courses there. Or maybe it could even be like a letter recommendation from a class that you had. And typically, I'm not sure if like they're PhD student or PhD professors or MD professors that teach them, but they can write in there, you know, how your performance is in that class, but overall have a conversation about you being a, you know, an extension post-bac student. And I think that should be okay.
Okay, another question we have is, what do you recommend if the main contact person that can vouch for your experience has retired or is no longer part of the organization you worked or volunteered for?
I'd say they can still speak on your behalf. I think if they're not working there anymore, but they, you know, have that experience with you, I would say you can still list them as somebody that can vouch for your experience there.
Yeah, I agree. This happened to me. I ended up listing somebody who, when I wrote down that experience that I worked at this clinic, she was the teen clinic's site manager or site director. But when I applied, she had already left that job. But, you know, when I listed that experience as, you know, working at that clinic, I wanted her, even though she's not in that role anymore, she can still speak on behalf on my experience then. So yes, I would just get their current contact information.
I think Dr. Diaz wants to comment on the question too.
Sure. I think one thing is to be proactive when you're maybe if you're going to take 2 years of a gap year or you're in your undergraduate career, start collecting letters as you go along. Okay, so you can ask the person to write you a letter. That doesn't mean it's going to go out tomorrow. Just have them file it. And then when you decide to go to medical school, you can go back to that professor and ask them to go ahead and send the letter, especially because that way you will be fresh in their mind. So that's one way to approach it. One other comment I wanted to make about the post-bac program at UCLA, self-directed, and there's other places that people do self-directed post-bacs, is you should pick one of the professors who really knows you. And then if you really have improved, give them a copy of your transcript. They're not going to have it unless you give it to them. Give them a copy of your transcript, tell them your story, and then see what happens as far as what kind of letter they're going to write.
Thank you, Dr. Diaz.
Yes, thank you so
have-
much.
Yeah. We have
I just want
some
to thank Dr.
questions.
Diaz.
Yeah. Let's see. We have some 2 other questions in the chat, and then Diana, you can ask your question. So one of the questions that we had in the chat was about overlap between the personal statement and the experiences. So they asked if we talk about certain experiences in our personal statement, should we pick something else for the 3 most meaningful experiences?
No, I mean, I want to say that if you talk about it in your personal statement, then it must be meaningful, right? And so you would want to kind of highlight that in your experiences as well. But I think if anything, it's just an extra opportunity for you to highlight different parts of that experience. And so I think if you include it in both, just make sure it's something you've done for a long period of time and that you have plenty stories to tell. You don't want to repeat yourself, but I think inadvertently, like the lessons that you learned from that experience are going to overlap, and so it's okay for it to be the same experience.
Go ahead, Dr. Diaz.
Yeah, what you can do is reference it in your personal statement. So you go into detail in your 15 activities because you have a little more space to talk about the specific activity. And then in your personal statement, you can just make a quick reference to what you did, because everything you did will be in your activities list. So you don't have to repeat yourself, just reference the place where you explained it better.
I know, Bo, you had your hand up earlier. I'm not sure if your question was already answered, or you still have the same question.
Yeah. Hi. Thank you so much for that. Thank you, speakers. That was really wonderful. My question was, I'm a non-trad student as well, and I was told that anything I did in undergrad, not to mention. So I was pretty surprised by Vanessa and like Jacqueline. Can you just share a little bit about that? Because yeah, I'm part of MSR through Mi Mentor, and that was advice that I got. So now I'm like a little bit confused. Thank you.
Mi mentor is, we're out here sending mixed messages. I'm sorry. I can say, like, so Jackie and I are both non-traditional applicants, and I think Jackie had a little more time than I did between changing careers. But so I took 5 gap years, and I definitely included things from undergrad, but the things that I included, I wanted to make sure that they were activities that I spent a significant amount of time in. And so like the volunteer opportunity, as I mentioned, that was 7 years from when I had done it. It was a really long time, but I still spent like a year doing that. And so it was a substantial amount of time, and it was still meaningful. And so I think if that's the case, definitely include it. If it was something you did for like a week in undergrad, like maybe it's not as important, but if it had some significance to you and there was like a lot of time involved, I think it's still fair game to include it.
I echo that 1000%. Yeah, I think for me, I included experiences in undergrad that spoke to like my passion for like teaching and mentorship. And so I included experiences that started ever since like undergrad. And it just kind of, it really strengthened that, like, okay, Jackie just didn't do this like right after she graduated. Like Jackie is committed to this work ever since, even before undergrad. But, I'm not going to mention high school stuff, So I think if you're really trying to showcase to medical schools that, this is a passion and this is kind of like your theme, it's more or less they're going to be able to see, okay, if Jackie did this for 10 plus years, she's pretty much going to do this probably in medical school and beyond. So I agree with Vanessa 1000% in terms of like, if it's something just like random, and that's the thing, like when you have so many experiences, like I didn't showcase everything, but then I had to kind of like figure out, okay, if I want to show this, like, okay, this is what Jackie is known for. That's why I started collapsing multiple experiences into one entry, and I was able to say, okay, over 10 years of experience, I worked with hundreds of students, you know. With research, I put since undergrad, but it was like public health research. And so I did it for like a couple months as a work study like experience, but it spoke about like my fascination with public health and how that influenced me as like pursuing a career in public health and even a master's. And you know, I see my career being very strongly influenced by it. So it depends on the context in which you want, what type of experiences. So I say yes, if you've been doing it for many years, think about collapsing it into like one entry. And I think it would really showcase, you know, like that quality.
Okay, so it looks like we're at 8:15. I know that we probably didn't get to answer everybody's questions, but like I said, for those who fill out the post-event survey, you guys will receive both of their emails. So any further questions you have, you can email it to them. We just want to be mindful of our speakers' time and your guys' time as well. Thank you so much, everybody, for attending. I'm going to put the survey link one last time. And thank you so much for joining us. And I hope you guys have a wonderful evening. And I just wanted to ask, let me stop recording.